Here at Westwind, we practice whole body care, integrated care between our mouths and our bodies. And when you come in for your dental visit, we will screen you for your medical diseases, any chronic diseases, any social problems that may lead to chronic diseases. And once we identify any risk factors, we will close your care gaps by collaborating with our medical team within the same office, and maybe even within the same day for you to get the whole body wellness care.
What we've always wanted to do, and we feel like we've really accomplished it here at Westwind at a really high degree and really high quality, is to connect that circle for the patient and make their workflow and their journey within our office really a whole body wellness journey. So whether the patient comes in for a dental appointment or for a medical appointment, we're making them aware of what's going on in their body.
Whether they're pre-diabetic or diabetic, whether they have high blood pressure, history of heart disease themselves or their family members, whether they have GI problems, breathing problems, if they have any autoimmune diseases such as lupus, if they're undergoing cancer therapy, all of that affects your oral health.
It's not about now, let's refer you back out to your physician or your PCP and you go ahead and take care of that. We can actually give them the opportunity to take care of it here in our facility. What it has really done, which is really wonderful from a healthcare provider, is allowed me to really be able to see the results in front of my eyes. By creating these processes to allow us to keep the communication line open and make the patient the center or the focus of that treatment, it has really elevated everybody's results.
Our mouths are the most innervated part of our body. That means we have the most amount of blood vessels in the mouth, and whatever disease is happening in your mouth, whatever bacteria is floating around in there, is going to float to the other areas in your body, especially to your heart. We try to make sure that we get all the touch points when we are chairside in the dental chair.
There's no guesswork anymore. We've got the results, we've got the data, we've got the history, and we're following up with it. We can really make a difference. We want patients to reach their healthiest selves. And if we can do that, we feel like we've accomplished a great deal for the whole community, for every patient that we see.